Crown of the head is up with the eyes looking down, heels away, maximum extension of elbow and wrist, maximum external rotation of shoulders, flex to the coronal plane, go out to the glenohumeral angle, press away. And while we are resting, let's continue with our exercise demonstration for exercises to help with spinal decompression. Right now, I'm going to be demonstrating the L1-L2 ELDOA. The purpose of this exercise is to create space between the L1-L2 vertebra, and if you have any type of compression at the L1 or L2 nerve roots, this can affect your hip flexion. In terms of the nerve plexus that is most likely going to be affected, it's going to be the lumbar plexus. And the nerve that's most likely going to be affected is going to be the ilioinguinal nerve. Also, the medial, intermediate, and lateral nerve of the thigh, the femoral nerve, and the obturator nerve. This can manifest as weakness in the psoas and also your hip adductors, as well as pain or paresthesia in the groin area or the anterior side. If you are experiencing any of those symptoms, go ahead and give the L1-L2 ELDOA a try. We're going back now to a bilateral exercise, which means you only need to perform this once. With regard to the exercise, this is going to be in a seated position. And what we want to do is take both of our legs and we want to go into maximum extension of the knees. From here, we want to go into dorsiflexion and inversion. So we're going into pseudo inversion by going into dorsiflexion by pointing the toes toward our head, inversion by pointing the soles of our feet inward, medial rotation of the coxofemoral joint by pointing those toes in. And if you can, try and get your heels up off the ground. From this position over here, we want to go into abduction, abduction away from the midline at the coxofemoral joint of 20 degrees. And then at the pelvis, we want to maintain retroversion of the pelvis. We're sitting on the ischial tuberosities or our sit bones where the hamstrings attach. The coccyx is pushing down into the ground. We have retroversion of the pelvis or a posterior pelvic tilt. We want to maintain a flat lumbar spine, flat thoracic spine, retropulsion of the cervical spine by tucking the chin in. The crown of the head is pushing up to the sky with the eyes looking down. Our heels are pushing away from our body with the sacrum pushing backward. And then with the arms, for this one over here, we want to go into maximum extension of elbow and wrist, maximum external rotation of shoulders, flex the shoulders to the level of the coronal plane, go out to the level of the glenohumeral angle. Depending on your morphology, it's going to be anywhere from 90 to 135 degrees, depending on the person. For the average person, when the palms are at the level of the forehead or slightly higher, that's roughly going to be the glenohumeral angle. And we're pressing away with the palms. So just to recap, we have maximum extension of knees, dorsiflexion, inversion, medial rotation, abduction of 20 degrees. We are pressing out with the heels. We got the retroversion of the pelvis. Coccyx is pressing down. We're sitting on the ischial tuberosities. We have flat lumbar, flat thoracic, retropulsion of the cervical spine. Crown of the head is up with the eyes looking down. Heels away. Maximum extension of elbow and wrist. Maximum external rotation of shoulders. Flex to the coronal plane. Go out to the glenohumeral angle. Press away. And we are going to maintain that position for 1 minute. After 1 minute, we can slowly come out of the posture, and that is how you would perform the L1-L2 ELDOA. If you are experiencing any type of either neurological symptoms or any type of weakness, pain, or paresthesia in any of the muscles that I mentioned, go ahead, give the L1-L2 ELDOA a try. During the next rest period, I'm going to be demonstrating the L2-L3 ELDOA, but for right now, our rest period is up. It is time for set number 4. That was just a tiny taste of what can be found in my members only section. If you enjoyed it, become a member for only $5 a month to get access to hundreds of member only videos.